Hello, my name is Dr. Larry Lenke, and I'm from New York, and I'm honored to be a past president of the Scoliosis Research Society, having served as president in 2011. And I'm here today to discuss surgery for scoliosis. Basically, scoliosis surgery today still consists of what's called performing a spinal fusion. And in the context of the spinal fusion, either the spine can be approached from a posterior route, which is in the back, or from an anterior approach from the side. But in both cases, instrumentation, various implants are placed into the spine to correct the scoliosis into a more normal alignment. And then a spinal fusion is performed where the vertebrae that are instrumented are welded together for permanency, so the movement goes away. And that basically is when the spinal fusion occurs. That can take anywhere between 6 months and 1 year to occur. But once that happens, then the corrected spinal alignment will remain forever, and the outcomes typically are quite excellent at that point. Yeah, surgery currently is very good at actually straightening the curve. So often now we can obtain 70, 80, even 90% correction of the scoliotic curves with current techniques of spinal instrumentation. So this also correlates not only to x-rays that look much straighter, but also that the clinical appearance of the patient and the various aspects of the scoliosis that patients can see on their bodies, such as unlevel shoulders, truncal shift, and rib or lumbar humps are impressively corrected during the surgery. And so that's one of the clinical benefits. That straightening of the curve radiographically correlates with improved clinical appearance of the patient. So a typical surgery occurs within 1 day, and normally that first night the patients are in bed, often with a pain button they can press for their own pain medicine. Typically the day after surgery, post-operative day number 1, the patient gets out of bed with physical therapy. They often sit in a chair and walk around the room or even in the hallway. They're still on pain medicine, usually transitioned from intravenous to oral pain medicine. Typically by post-operative day number 2, pain medicine is always on by the oral route. Patient is much more ambulatory. Sometimes the drains, any drains that are placed in the surgical incision site will come out. Often if there's a bladder catheter, that will come out. The patient often begins to drink a little bit and often even eat if their stomach tolerates that. And by post-operative day 3 and 4, typically all the drains and tubes are discontinued. The patient is being cleared by physical therapy, and often by day 3 or 4 or latest 5 are ready to be discharged from the hospital. So that's the early recovery. Then progressing on, typically patients are ready to go back to school within 3 to 4 weeks, depending on how they feel. Resuming more normal activities within 4 to 6 weeks typically, and it's normally up to the patient depending on how they feel. If they are athletically inclined, they can often start participating in their athletic activities within 6, 8, 10, 12 weeks, depending again on their comfort level and the degree of participation. And usually by 6 months, patients are completely released to be free to do whatever activity they like to do, and are back at normal activities by then. Yeah, so there's some debate still as far as what activities are not allowed following scoliosis fusion. There's one camp that is against any violent or high contact sports like football, ice hockey, things like that. But there's some patients, depending on, again, the levels of fusion that are allowed to participate in sports like that. It's somewhat individualized. You have to ask your surgeon about his thoughts on that. Things like high-level gymnastics, again, are very patient and surgeon dependent, and also depending on the type of surgery that one has. So again, there's a lot of debate still within our society and our members on the degree of high-level athletic participation. But we're finding more over time that patients are doing more and doing well and doing it safely. And so I think that's somewhat of an evolving field. And I think we'll, in time, realize that patients actually can lead a quite normal life following scoliosis fusion. And I think that's obviously all for the better. So typically, we do not recommend removal of the instrumentation, the rods or screws or hooks following the spinal fusion. And the main reason for that, number one, it's another surgery. So who wants another surgery if it's unnecessary? Number two is that we find that even though the spine becomes fused, that if the instrumentation is removed, the fusion is still live bone. And live bone reacts to stress, and live bone likes to return to its original position. So often we'll see the deformity slowly recur over time. The spine fusion can bend actually over time, or can even break if the fusion area is not very solid. So at the end of the day, it's really not recommended that the implants are ever removed. The only main indication would be if there is an unfortunate, very rare circumstance of a chronic spinal infection. Then often the implants have to be removed to completely clear the infection. But again, that's a very rare occurrence, and really the only indication currently that most surgeons would ever consider removing the instrumentation. Unfortunately, the rods can break, and that's, again, a very unusual occurrence as well. That is almost always associated with what's called a pseudarthrosis, or non-healing of the fusion. So basically, you can consider if the spine fusion doesn't take, that will put increased stress on the instrumentation. And you can consider the rods, even though they're quite thick like a pencil, actually we have an example here on the spine, they're quite thick and strong, but similar to a paperclip, that if a paperclip is bent multiple times, ultimately will break. Well, if one of these rods continues to bend because there's movement, because the spine hasn't completely fused, then ultimately it will break as well. And often that does require revision instrumentation, because usually if the instrumentation breaks, it does cause pain and can cause also increased deformity. So the majority of patients with broken instrumentation will require revision instrumentation to repair the breakage of the rods and repair the area of non-fusion.